my approach to patient care is relatively straightforward. When the patients come to you, they're typically scared, they're nervous. Having cardiac surgery is probably one of the biggest things that they're ever going to go through. The first thing we have to do is reassure them that they're in a good spot. We typically have options, and we have options that, while some of them are less invasive and some of them are more invasive, at the end of the road, we have solutions that are going to help solve their problems. We not only have to do a good job of taking care of them on the front end, meaning making sure we've done everything we can to prepare them for a good outcome, and then most importantly, really look after them on the back end. And I think that's an area that I particularly am fond of, which is not just doing a good operation, getting them set up, but then really looking after them afterwards so that you can transition them back to their cardiologists and their primary care physicians. All too often, I think sometimes we're so focused on the operation, we forget a little bit about what has to happen before and what has to happen afterwards. Having had family members who've been sick, the reality is you start to realize where the gaps are in today's medicine, and the gaps really are in what I call phases of care. We have to really do a good job of bringing these patients in, do our job of what we're tasked to do, but then we have to do an incredibly good job of actually sending them back out to their homes, their communities, and their primary care physicians. If we pay attention to all three phases, I think that's when we get an outstanding result.